Good morning. I'm going to do a volumetric exerciser, which is an intensive spirometry. So the first thing I'm going to do is check the patient's chart, and I'm going to look for and see if they have any pain medications, anything like that, and coincide with this treatment. So here we have a volumetric exerciser. So the first thing I'm going to do is always introduce myself when I come into the patient's room. Example, like, hi, my name is Amy. I'm a respiratory care student with the respiratory care department. And so today I'm here to help you exercise your lungs. So basically we're gonna practice expanding your lungs and helping you get those lungs open and helping you keep out those secretions. So when I'm ready, I'll wash my hands. I check the patient's ID band and check their vital signs, and I'm just gonna take the lungs to listen to see what their lung sound like. And many times, so with this, we do this treatment so that way they prevent any atelectasis, anything like that to happen with their lungs, especially if they've had surgery or if they're bedridden for a while. That way we keep their lungs functioning and keeping them strong and healthy. So here we have the volumetric exerciser. So here each volumetric exerciser comes with a chart, so I'm going to use it as an example. So I look at my height and then my age range. So I'm going to be around the 1900, 1850 range. So what I would do is I examine the machine first before I appropriately use it, just to make sure there's no cracks, nothing wrong with it, and then I prepare it. So I'd set it first at where I want it to be at. And if this is their first time, the patient's first time, you can start at a lower inspired volume. And then if they can't quite get to their appropriate level. So you can make a set goal for them if they can't quite get it. So you're gonna take this and you're gonna hook it up to your volumetric exerciser here. Like that. Make sure it's tightly sealed on there so it has a good, so that way we get the appropriate flow from when they do it. So what we will do is we will have the patient sit up on the bed, and if they've had surgery, to keep them comfortable, we can place a pillow in front of them to keep them comfortable when they do this, because for them sitting up may be a little more painful, and so we don't want to cause too much discomfort for them. So when we are ready, I will demonstrate on how we're supposed to do this. So basically what we're gonna do is have them take a nice inhale and exhale. We're gonna have them exhale all the air out. And when they go to inhale again, we'll have them place their mouth tightly sealed around here. And then we'll inhale. As they inhale, we have to have them hold 3 to 5 seconds. So what we're gonna do is we're gonna do a nice inhale, then exhale. And after the 3 to 5 second breath hold, we will have them exhale away from the mouthpiece, so that way we're not blowing in here and getting moisture in here. So if they don't quite get to their breath hold, that's fine. We just have to note that they have to continue to practice to build up that strength. So if they can't quite get it, we will set a start goal, and we'll continue to practice with them, so that way we prevent any atelectasis or anything like that. And each patient will be different when they have their thing, but when we are done with this, we can remove it carefully. And so this you can set off to the side. You want to set it close to their bedside, so that way if they have to practice within the hour, you want to at least have them do it 6 to 10 times per hour, depending on how well they do it. If it makes them feel lightheaded, you don't want to do it too many times after one another. You want to keep it kind of spread out, so that way they don't get overwhelmed with it. So this, you can take out the mouthpiece and you can wash it with sterile water when you're done, and let everything air dry when you're finished. And with this here, you can put the patient's name and their patient's room number and date that you gave them the machine. because this is something that they can take home with them if they want to continue to exercise their lungs at home to help them cough up any secretions. So you would set that off to the side so that way they can reach it. And when I'm done, I would reassess the patient. I would make sure they're doing okay, their vital signs are okay, and I would also listen to the lungs to see if the treatment's helping clear up any lungs. And if we need to help them cough up anything, depending on what kind of surgery they had, you don't want to do any like hand percussion on them if they can't. If it had any surgery like that, you don't want to hurt them anymore. So then when I'm done finishing checking the patient, everything, I will remove my PPE, and then I would wash my hands, and then I would go and document on the patient's chart what I did for the patient.